Hey, welcome back to the show. Endometriosis affects approximately 176 million women worldwide, regardless of their ethnic and social background. Now, endometriosis is also a common yet poorly understood disease, striking women of any socioeconomic class as well as race. Now, joining us to share more details, we got the Associate Fellowship Director of Minimally Invasive Gynecologic Surgery at Montefiore and Assistant Professor at Albert Einstein College of Medicine, Dr. Kari Plewniak. And Dr. Kari, thank you for being with us.
Oh, thanks so much for having me. I'm really happy to be here to talk about endometriosis.
Yeah, you had that large title. I want to make sure I got it all right there,
Oh,
but thank you so much.
thank you.
No, thank you. And having this conversation about endometriosis, when we talk about it, as we said, it's something that sometimes many people are not so familiar with.
Yeah, we do know that many people aren't familiar with it, both patients in our general population, but as well as healthcare providers. And so there's often a really long delay between symptoms, even bringing those symptoms to a doctor and getting to diagnosis.
Yeah. So for the average person who doesn't know, let's introduce them to exactly what is endometriosis.
Yeah, so endometriosis is where we have tissue that's like the endometrium, which is the lining of the uterine cavity. Tissue like that ends up outside the uterine cavity. So most often in the pelvis, on the ovaries, and on the pelvic organs is the most common location.
And when we talk about it, is diagnosis. Is it hard to diagnose? Is it something that, the average person will be able to say this is that? Or talk to us about how you get to the diagnosis.
It's really interesting. So the real true diagnosis is made with surgery almost always. But we can use symptoms and history to have a really high suspicion and even just start treatment before having that surgical diagnosis.
Yeah. You brought the word symptoms, and for many people, give us a walkthrough as to what are some of the common symptoms that a person has when it comes to endometriosis.
Most commonly, and what people, if they've heard about it, will probably know about, is painful periods. Um, there's a lot of different cultural perceptions around what a period should be and how taboo it is to talk about periods in general. But if we see someone who's missing school or missing work because of pain around their periods, that's really should be a red flag and should people should bring that up to their doctor. But it can also come with other symptoms: pain with intercourse, pain with sex, could be infertility, or could be no symptoms at all.
So several symptoms for people to be aware of. We hear, and, commonly a lot of myths, and we hear a lot of things that are associated with it. So let's take a few seconds, if we can, to maybe look at some of these myths and some of the stereotypes that have been associated with this, and how can we possibly debunk those. So, what are the most common myths that you hear when it comes to endometriosis?
The most common myths, I think there's a lot of fear around contraception, and that contraception can cause a variety of different problems. We do see that most hormonal contraceptive methods actually treat a lot of the symptoms, but there are some myths around hormonal contraception causing infertility or causing a multitude of things. And really, the things that are on the market now are actually very safe and effective, and have no causative blame here when it comes to endometriosis.
Yeah. Many times when we talk about particular issues and/or diseases, there's always these health disparities. You can talk about high blood pressure, anxiety, prevalent in the African American community. But when we talk about endometriosis and it comes to women, it seems as though that it's just pretty blanket across the board. Am I correct?
Yeah, we know that overall 1 in 10 women have endometriosis. And so it's very, very prevalent, but is one of those neglected diseases that we often see in women's health, unfortunately. And so women often take on lots of burdens around the house and may forego their own medical care for their family and other priorities. So we do see this as often neglected kind of across socioeconomic strata.
Yeah. So let's talk about treatment for a moment. If a person is diagnosed with endometriosis, what are the common treatments? Are there several available?
There are many available, and it really
Yeah.
depends on symptoms and fertility goals. But again, hormonal contraception tends to be first line. Many of the methods we have available prevent or suppress ovulation or cycling, and can really help with symptoms. And often that's all that's needed, but it really just depends on the patient and their fertility goals.
You spoke a little earlier about pain and how pain can be prevalent in a potential patient with endometriosis. What about that pain? How sharpening is it? Is it really a debilitating pain?
It really depends on the patient. Some patients have no symptoms. Some patients only have symptoms with their menses or leading up to their menses, right up to their period. So it really depends. But often we do see patients who have endometriosis may often have irritable bowel syndrome or painful bladder syndrome, what we think about as chronic overlapping pain conditions that can all affect the abdominal pelvic organs. So really getting a very thorough history for these patients and kind of treating all of the diseases that might be might be ongoing for them holistically is really important.
Yeah. And is this one of those diseases that run through the family line? We hear sometimes, being checked for this, being checked for that. Is it something that goes through the family line?
We do see that sometimes it clusters in family, and there is some genetic component there.
Mm. So when we talk about treatment, obviously that's one thing, but getting detected and finding out more about that, testing. How often should a person go to possibly receive testing if they feel that this is their case?
Yeah, if they think this is their case, they should really bring it up with any provider they see, but ideally with a OBGYN, or someone that's doing their annual gynecologic care. And if they don't feel that they are being adequately heard or anything like that, then they can seek another provider. But there's also good patient information out there. Endometriosis.org is a great website, a good resource for patients with reputable sources.
Mm. And give me a little bit about the correlation between endometriosis and scar tissue, because I understand there is a little correlation there.
Yeah, we do see, it really depends on the severity of the disease. There can be just minimal scar tissue, but it can be pretty advanced and involve scar tissue that really glues sometimes the other pelvic organs, bladder, bowel, rectum, ovaries, to the uterus and to the other pelvic organs. So the scar tissue can be advanced, but I don't want to scare people. Not everybody has that advanced disease, and sometimes it's pretty minor. But surgery does have a role in treatment, really in removing as much endometriosis as we can.
Mhm. And how does it work in the area of fertility? Because we hear it does affect, you can have painful periods, things of that nature. Is there some sort of fertility consequence as opposed to this?
There are. So we don't see infertility with all of the patients who have endometriosis, but it is a common reason um, that causes infertility. It is a complex issue, and really depending on the location of the endometriosis, we have data to say, it's really good to go remove this endometriosis, whereas if it's at this location, maybe not. So um, it is a complex question. But we do see a correlation, unfortunately, between endometriosis and having trouble getting pregnant.
Yeah. And before we go, talk to me one more time about treatment. When we talk about treatment and those persons that have to endure that, is this treatment a lifelong treatment, or is there the possibility that this can just go away?
So typically, um, we do recommend treatment throughout the reproductive lifespan. So symptoms go along with periods most often, and they resolve after menopause. And so it's not lifelong treatment typically, just from diagnosis through the age of average menopause, or when that person does go through menopause. But we do, even after surgery to remove all visible disease, we still recommend hormonal treatment most often until 50, early 50s.
Dr. Kari Plewniak, thank you so much for being with us and sharing with us a little bit more about endometriosis. I think our viewers have learned a lot today, and certainly, hopefully, if they're feeling some of these symptoms, that they can get to their doctor and possibly be diagnosed. So thank you so much for being with us.
Thank you. I really think this is so important to really highlight, a neglected disease for women's health. So thank you so much for having me and speaking with me about endometriosis.
My pleasure. Dr. Kari Plewniak, our guest here on Open. I want to let you know now, if you want more information, please don't hesitate to go visit the website at montefiore.org. There you can find out about endometriosis and a whole lot more. And speaking of a whole lot more, guess what? We got a whole lot more open. Stay with us. We're coming up right after this.